and it says, I need to build more blood because blood is going to have hemoglobin, and hemoglobin is going to carry oxygen, and I need that, right? So it's going to create more blood, and that's the thing. Okay, so here we have, so they're pink puffers. So there's increase in CO2 retention. So no cyanosis here. And again, like I said, so in the beginning, this is what it looks like. But at some point, if they continue not to have the oxygen, we're gonna see cyanosis. But in the beginning here, we're only talking about the beginning stages. So no cyanosis, pursed lip breathing. What's the pursed lip breathing again? Yeah, so we just mentioned it, right? So what it does, it gives them more control. It helps them relieve themselves of the carbon dioxide that's stuck. So it's kind of like pushing the paper bag like this. So they're doing like the exercise to release the carbon dioxide or the air that's trapped inside. So the more they can go, and the better they can clear the lungs of the carbon dioxide or the air that's trapped inside. Dyspnea, ineffective coughing, hyper resonance in chest percussion. You see that hyper resonance where it would be coming from, the barrel chest, right? We have, and what's the barrel chest about?
They're forcing the lungs to expand so their chest starts growing.
Not forcing the lungs to expand, because remember, the force is to get rid of the oxygen, right? This is more like them leaning like this and sitting up because they want to expand. It's the posture. So the forcing of the lungs to expand is more like the posture, and so because of the posture, they're expanding their lungs. So we have the orthopnic, we have the barrel chest, we have exertional dyspnea, prolonged expiration time. That's the breathing, the pursed lip breathing we mentioned. Speak in short, jerky sentences. So this one is when, like, whenever a person is short of breath, right, and they can't catch their breath, right? Words take energy. Eating takes energy. Talking, everything, takes energy. So if you find a person, and same thing happens with an asthma person, patient, they come in and they're talking, they're like, so I don't want to go to the, right? Like, in order to speak, they have to catch the breath. So a lot of times we count how many words they're saying in between to see how bad this thing is. If they're talking with regular speech, we're like, okay, it's not as bad. But once they start catching their breath in between words and not sentences, we know that there's a big problem. Anxiousness, use of accessory muscles to breathe, thin appearance leads to right-sided failure. So same idea, it's coming from the lungs, right? So it's going to go back to the blood that's coming from the lungs is going back to the heart, and that's going to cause heart damage, which is going to be heart failure, okay? So let's talk about complications. Heart disease. Again, we talked about heart failure, which yes?
Is these slides going to be on our exam for this week, for Wednesday?
Yes, okay. Yes. Mm-hmm. So this is all oxygenation, right? Yep, So heart disease, right? So we have so we already mentioned, right, heart failure, and we said which side again? Right side. So we had left side. You'll see left side has to do, will now affect the lungs because it's going back to the lungs, right? That's different. This one is going back to the heart from the lungs, so it's a little different. When we talk about left-sided, we'll have crackles. This one we won't have crackles, we're having edema, so there's a difference, right? So heart disease, the right-sided. We have pneumothorax. What's the pneumothorax? What problem? Yes, right? So we have the alveoli, right? Because of tension, because of pressure, right? We talk about the pressure can be too much and it collapses, right? And so we have that problem there. Risk for pneumonia. Why do we have risk for pneumonia? So it's weak, right? It's not working properly, and the person has mucus buildup, probably moisture, attracts bacteria. So there's a few reasons why there's a risk for pneumonia. And lung cancer. Why risk for lung cancer? So thinking back to differentiation, what did we mention is the differentiation that's happening? because with the cancer, I mean with the smoking, what's happening? There's a change in what? There's a change. There's a change in the environment. The cells are doing something different. They're increasing their mucus production. So they're increasing in size. They're like, we gotta beef up to do this job better, right? And so they're growing bigger in order to produce more mucus. And God forbid, they might just not stop growing, right? And they're changing their environment, and that environment can just proliferate and just keep adding, keep producing more cells, because it thinks that it needs to do more work and it doesn't switch off. And so then we can have lung cancer. Okay, so we mentioned this. So this is the PFT. So what would this entail? This is like our diagnostic, right? We're trying to figure out how bad are the lungs. And so this is a test that measures a lot of different things, right? So it's pulmonary function test, right? And so it has a few things that it looks at. They use the spirometer, which causes them to see like what is the lung capacity, what's the vital capacity, right? It looks at there's a plethysmography, where you're sitting or standing inside of an airtight box. It looks into like a short square telephone booth kind of thing. So what is it measuring? It's measuring tidal volume, it's measuring minute volume, vital capacity, the functional residual capacity, total lung capacity, forced tidal capacity, forced expiratory vital volume, forced expiratory flow, and peak expiratory flow. So the test that they do measures all these things to see how healthy are our lungs. Will you need medicine? Will you need to be evaluated further? What's the issue that you have? Where is the problem? But all of this is to see, how well your lungs are doing.